How do you calculate your Medicare costs? Imagine trying to plan your healthcare expenses without knowing what to expect. That's why understanding how to calculate your Medicare costs can make a big difference in managing your budget. Let's walk through the steps to help you figure out what you might pay each year. First, you need to know which parts of Medicare you are enrolled in. There are four main parts: Part A, which covers hospital stays; Part B, which covers doctor visits and outpatient care; Part D, which is for prescription drugs; and Medicare Advantage Plans that combine several benefits. Each part has its own costs to consider. Starting with premiums, these are the monthly payments you make. For Part A, most people don't pay a premium if they or their spouse paid Medicare taxes while working. For Part B and Part D, premiums are based on your income from 2 years before. The government looks at your modified adjusted gross income, which includes your adjusted gross income plus certain non-taxable income like tax-exempt interest and non-taxable Social Security benefits. If your income is above specific thresholds, you will pay an extra surcharge called the Income-Related Monthly Adjustment Amount. The Social Security Administration uses your tax return from 2 years ago to set your premium for the current year. Next, look at deductibles. These are the amounts you pay out of pocket before Medicare starts sharing costs. For example, Part B has an annual deductible of $166.50. Once you meet that, you usually pay coinsurance, which is typically 20% of the Medicare-approved amount for services. So if a doctor visit costs $200, you pay $40 after meeting your deductible. It's also important to consider whether your healthcare providers accept Medicare assignment. Providers who accept it agree to the Medicare-approved amount, which helps keep your costs predictable. If they don't accept assignment, they might charge more, up to a limit called the limiting charge, which can increase your expenses. To estimate your total costs, add up your premiums for each part you use, any surcharges based on your income, deductibles, and coinsurance for the services you expect to need. Remember, some services like dental, vision, or hearing are not covered by Medicare, so you might have extra costs there. If you choose non-participating providers, your costs could also go up. Managing Medicare costs involves knowing your income, understanding your healthcare needs, and choosing providers wisely. Using official Medicare calculators or worksheets can help you plan your budget. Tracking your income and preparing for possible surcharges can prevent surprises. Knowing your deductible and coinsurance responsibilities helps you set aside enough money for out-of-pocket expenses. In the end, calculating your Medicare costs is about understanding the different components: premiums, deductibles, coinsurance, and additional charges, and how they fit together based on your personal situation. Staying informed and planning ahead makes managing your healthcare expenses much easier.